The National University Hospital has become the world's first hospital to receive an international certification for greener healthcare. It has been recognized for reducing plastic use, switching to materials safe for the environment, and cutting energy use by 40% in operating theatres. Teng looks at the efforts.
Here at the National University Hospital, healthcare workers are not just saving lives, but also the planet. Like this medication trolley that helps nurses sort plastic and paper waste. It's boosted paper recycling by nearly 50% and more than tripled plastic recycling rates. It's a project started by nurses for nurses.
We do have bins, recycling bins in the designated area in each individual wards. However, these we take an effort for the nurses to walk to the area to recycle. So majority of the waste that we have actually went to the general bins, unfortunately. And with this sort and source, then it is more easily available at that bedside itself.
The hospital is not stopping there. It's aiming to hit 60% recycling rate throughout the organisation by 2030, up from the current 10%.
The biggest bottleneck for recycling is there are actually no takers or limited takers for recycling materials. We believe that it's a chicken and egg thing. If you do not have scale, there will be no takers. So we believe that it is important for us to start this going, and then hopefully over the next couple of years there will be more takers to accept or adopt these recycling materials.
He says green efforts like these often lead to cost savings without compromising patients' well-being. For instance, by changing its anesthesia breathing systems weekly instead of daily, the hospital cut carbon emissions by 5.4 tons, equivalent to powering around 3 HDB flats for a year. It's also saved close to $40,000 annually. The healthcare sector faces unique challenges when it comes to reducing waste. Running 24/7 and needing extra stringent controls, the sector is water and energy intensive. Healthcare facilities also produce large amounts of biohazardous and pharmaceutical waste, which, if not treated properly, can damage our larger environment.
Globally, the healthcare sector generates about 4% of total greenhouse gas emission. Contamination of land, contamination of waterways, ultimately polluting rivers, ultimately polluting oceans. And it comes back into the food chain, it comes back into the food that we are eating. So actually healthcare, pharmaceutical, upstream, downstream actually has a significant impact, significant footprint on the planet.
Other initiatives at NUH are underway, such as the repacking of knee replacement surgical trays. It's helped save over 150,000 litres of water and over 1,000 man-hours every year.